Nursing NCLEX RN Review Video, Isolation Precautions. In this video, I'm going to talk about isolation precautions needed to know for the Nursing NCLEX RN exam. Before I begin, be sure to check out the description box for various free NCLEX content and subscribe as I upload at least one new video every single week. Precautions on various illnesses and the different steps to adequately protect yourself from various illnesses are one of the highest yielding question categories on the NCLEX. It is a given that you will at least get one question on precautions on your NCLEX exam. That is why it is extremely important to remember the different types of precautions and remember which illnesses require different methods of protection. The 4 types of personal protective equipment precaution types are: number 1, standard precaution; number 2, contact; number 3, droplet; and number 4, airborne. Standard precaution requires you to perform and wear hand hygiene and gloves. Contact precaution requires you to perform and wear hand hygiene, gloves, and a gown. Droplet precaution requires you to perform and wear hand hygiene, gloves, and a mask. Airborne precautions require you to perform and wear hand hygiene, gloves, and an N95 mask. Before I continue, these videos take a long time to make, and if you'd like to see more videos like this, please give me feedback by either giving this video a thumbs up or a thumbs down. This will help me decide whether I should continue making more videos like this in the future. Thank you. Here's when to use standard precautions. Every patient you encounter, you need to wear standard precautions. Patients that require contact with any type of bodily fluid. Here's when to use contact precautions. Anyone who has a transmittable disease via contactable sources. So resistant bacteria such as MRSA, VRE, and C. diff are a few. Here's when to use droplet precautions. Anyone who has the ability of transmitting through a small particle. So examples of this would include meningitis, pertussis, influenza, and of course the coronavirus. Here is when to use airborne precautions. Airborne is transmitted through the air, so things like measles, tuberculosis, varicella are just a few. Now, here are some tips that will help you remember this for the NCLEX exam. For standard precautions, use the acronym V-CHIPS. V standing for varicella, C standing for cutaneous diphtheria, H standing for herpes, simplex and HIV and hepatitis B and C, I standing for impetigo, P standing for peduculosis or lice, S standing for scabies, and S also standing for secretions, excretions, and bodily fluids. For contact precautions, use the acronym MRSW. M standing for multi-drug, R standing for respiratory infections such as RSV, skin infections, wound infections, enteric infections such as C. diff, eye infections such as conjunctivitis or red eye. There's also just some other ones you just have to remember, such as adenovirus, diarrhea, rotavirus, E. coli, salmonella, hepatitis A, herpes, RSV, if the cough is productive. For droplet precautions, try to remember Spider-Man. So sepsis, scarlet fever, streptococcal pharyngitis. For P, paravirus, pneumonia. For I, influenza. For D, diphtheria. For E, epiglottitis. For R, rubella. For M, mumps, meningitis, mycoplasma or meningeal pneumonia. For A, adenovirus. And R is just an exception, which would be RSV. For airborne, try to remember my chicken has TB. So measles, chickenpox, herpes, tuberculosis. So that is going to be the end of this video. Check out the description box for free websites that allow you to test your memory for isolation precautions on the NCLEX exam. Thanks for watching, and here's how to get to my website. Hey guys, just thought I would show you how to get to my website. All you gotta do is go to Google and search Simple Fit Nurse, or you can go to your web browser and search www.simplefitnurse.com. In my website, I have free ebooks that I've created. I have a free fitness guide, I have a free NCLEX guide, and I have a free nutrition guide that I've created, and it's all free. You can click on the appropriate tabs at the top of my website and you get access to them. I do post blog posts every single week with my videos, and they're helpful if you want to take a look at graphs and diagrams that come along with that. I also have a NCLEX review session where I post all my NCLEX content, so be sure to check those out. Also, if you're interested, check out these videos and be sure to subscribe for more content every single week. Thank you for watching, and thank you for making it till the very, very end. I appreciate it. See you next time.